Social trauma, so welcome.
Ben Bakırköy Ruh ve Sinir Hastalıklarında çalışıyorum. Çocuk ergen psikiyatrisi ve Çematen Polikliniğinde çalışıyorum. Bu konu özellikle önemli. Bizim klinik pratiğimizde bize başvuran olguların çoğunun orta ya da ağır çocukluk çağı olumsuz yaşantıları ihmal.
Negligence, abuse, exploitation, institutional care are all some of the factors that might cause substance abuse and alcohol abuse in the later stages of life. However, for these factors, we know that they can be influential on the prognosis, and these people are more inclined to use alcohol or a substance to cope with the certain challenges in life. Interpersonal trauma has relationship with the start of drug or substance abuse. For adolescents, they start earlier, they use it more frequently, they move on to heavier substances more quickly, and they have a very quick onset of intolerance. These are more prevalent for men, but also particularly for methamphetamine. It can be happening in women as well. A complex trauma will probably take place in ICD-11, starting from the childhood. Sustained, discrete but sustained trauma and negativities is referred to. Difficulty to settle is a risk, increasing the possibility of drug abuse in later life. When we look at the neurobiological studies, we see that HPA axis regulation, glucocorticoid receptors expression, hippocampus, amygdala, cerebellum, cerebellar vermis, corpus callosum, and hemispheric integration deformations take place. We also see a higher level of noradrenaline levels. Alpha-2 receptors are regulated downwards. Locus coeruleus and noradrenergic activation is damaged. Neurotrophin levels, synaptogenesis, synaptic conjunctivitis, and causality and neuronal survival come down. Inappropriate sexual behavior might be exhibited, and as a result of the trauma, victimization might take place. There might also be some cognitive disorders, deformations, emotional and empathic, pseudo-autistic findings might emerge. When we look at the damages in the cerebellum and cerebellar vermis, we see that there might be negative changes in the norepinephrine and dopamine pathways. In addition, the smaller cerebellum and vermis volume mean that there might be more inclination towards drug and alcohol abuse. Negative experiences during childhood and how it affects inclination towards drug use in later life. There are two types of gene relationships. The first one is the serotonin gene. Childhood years, negative experiences have impact on cognitive functions as well. They have difficulty making use of spare time, getting bored very quickly, lack of determination at school, looking for something to do might be some of the ways that increase that inclination towards drug and substance abuse. All of this deterioration is symbolized in many different ways, as we see from studies from overseas. CCLY might also mean that there might be difficult on the part of the child to make sense of the world. There might be some actions, responses, higher depressive memory, and some other cognitive problems. And these children will find it difficult to suppress these negative memories, and accordingly are more inclined towards drug and substance abuse. When we look at the trauma spectrum disorders, one of the most important pathologies is DHB. The existence of DHB can cause drug and substance abuse, but also drug abuse itself can be a reason for trauma. Destructive learning problems or disabilities, aggression, committing crime, explicit sexual relationships might also cause these problems. When we look at the traumatic spectrum disorders, we see that there are different pathologies referred to in each studies. DHB is deemed to be the starting point, borderline features, aggression, eating disorders, anxiety, depression, drug abuse, and DSM-5, trauma, disinhibited social engagement disorder, are some of the genetic, psychological, and social factors and play a role. And among all the psychopathologies, there is very complicated relationships. Negative experiences during the childhood years can cause an inclination towards drug abuse, but drug abuse itself can also have an effect on the prognosis of these disorders in a negative way. We also know that these people are more inclined to subject their children to sexual abuse. They might themselves have been victims of such abuse. This means a deteriorated ability to commit themselves to a relationship, increasing risk for drug abuse. When we look at trauma and related pathologies, DHB diagnosis is extremely important, particularly if there is parental negligence. There might be difficulty in commitment, establishing social relationships. And if DHB exists, this can be further exacerbated. Traumatic life experiences, negative experiences during early years of life, and drug abuse, inclination towards violence and crime might exist. If that's the case, then atomoxetine can be used, clonidine, guanfacine, fluoxetine, venlafaxine, implamine, and in the recent years we also see agomelatine being used with or without autism. When we look at trauma spectrum disorders, in many negligence cases, we see existence of alcohol or drug abuse. The genetic material through epigenetic arrangements might mean an inclination towards drug abuse or alcohol abuse. And this is yet another important factor in terms of intergenerational transfer of these genes for drug and substance abuse. Adolescents, therefore, drug abuse can make these young people more vulnerable towards trauma. So they might be victims of the situation, or they might subject other people to such victimization, and to do that they might prefer to be under the influence of substance. TSSP diagnosis might be more frequently received here. For those who were subjected to sexual abuse during childhood years, there might be deterioration in the perception of safety and security. There might be more inclination to take more risk. There might be promiscuous behavior. And there might also be the emergence of traumatic identity organization. If that's the case, after the sexual abuse, re-victimization, poly-victimization are more frequently observed. For victims of sexual abuse, alcohol or drug use might also be a way of defense mechanism, but that also increases the risk of sustained sexual abuse. For men, there might also be a relationship between a sense of indifference that emerges due to the sexual abuse, increasing the risk of sustained abuse for these cases. And we also know that withdrawal symptoms for these children might be confused with overstimulation, which might increase the drug and substance use. Particularly for homeless children, the children on the streets and those who have been traumatized in the prison are extremely under risk. Cannabinoids might cause sleep disorders, they might cause overstimulation. When we look at TSSB and MKB as a combination, we see that trauma-focused PDT, EMDR, and group therapies can be used for SSRI and SNRI. We can think about clonidine, propranolol, topiramate, lamotrigine. If for other patients, gabapentin and pregabalin can be prescribed. Risperidone, quetiapine, and other atypical antipsychotics can also be used to reduce the symptoms. Najavitz and Walsh in 2012 have talked about a conflicting situation, a contradictory situation about chemical dissociation hypothesis. But in other studies, as you know, dissociative indicator was added. If that is the case, then there is a higher level of drug use, particularly for opiates, and re-victimization is possible, it's claimed. Abuse during younger years is also associated with dissociative indicators. Depression, somatization disorders, borderline personality disorder might emerge, and their drug abuse can be even more severe. Regarding this trauma, another important disorder is the borderline personality disorder. In these cases, the onset can be quite early. There might be comorbidities. There might be disorders with regards to reward mechanisms, and there might be a higher level of cocaine usage with higher or severe withdrawal symptoms. 19% of substance abusers have borderline personality disorder. In some other studies, this figure is suggested to be closer to 50%, particularly incest victims and their parents have found to be more frequently suffering from borderline personality disorder. Childhood years traumas distort the compliance strategies of children, and they have problems in emotional regulation. And child abuse and negligence. Apart from borderline personality disorder, there might be various problems like bulimia, dipsomania. We see these cases very often in our clinics. Some typical medications could be SSRI, VPA, lamotrigine, topiramate, risperidone, or ariprazole, or we could also think about topiramate and fluoxetine in addition to SSRIs. Tematem, in these cases with borderline, we also see quite often bulimia. If you are DDT trained, if you have a DDT supervision group, then for borderline, for drug abuse, this can also be employed, and it's quite effective. When we look at crime and aggression, we see that children who are raised in inappropriate conditions, in a bad neighborhood, in chaotic families, there is a higher risk of being victimized in trauma, or they are the traumatizers creating victims, and children who are born in these inappropriate conditions and adolescents, there is less of a clarity between the perpetrator and being a victim. It's a two-way interaction. The stimulation findings in TSSB, the inclination to be more bold with a lower perception of risk, are correlated with the inclination towards committing crimes. These children want to make themselves appear more stronger, therefore they resort to drug or substance abuse for survival reasons as well. Drug users, those who are inclined to crime and aggression, we see this very often in adolescents. We can use a combination treatment with quetiapine, valproic acid, risperidone, propranolol, lamotrigine, topiramate, and sometimes buspirone could be used for aggression. When we look at the substance and drug use and trauma relationship, particularly for girls, usage of these more expensive drugs might mean that they might choose to or push towards prostitution to finance their drug addiction. As you are all aware, flunitrazepam, MDMA, ecstasy, gamma hydroxybutyrates, GHBs, might unfortunately make these children more inclined towards being victims of sexual abuse. Of course, this is very traumatic because these young people try to cope with the high level of uncertainty. They see adults as inconsistent and not trustable. They perceive the world in a hostile way. They feel like they have to be alert at all times. They are either fearless or they are extra scared, and they have commitment problems. They try to solve their problems on their own due to lack of ability to commit themselves to a relationship. There might be reverse commitment, where we see the child acting like a parent. Self-mutilation and drug abuse are frequently observed. If there are any behavior problems in the parents because of genetic interference cause trauma on their children, and there might be certain genetic changes which further exacerbate the existing genetic risk profile. These are further and hence the effects of the trauma. If one of the parents is in this position, that increases the risk of sexual abuse towards the child. Borderline personality disorder and the existence of other psychological diseases coupled with drug and substance abuse might mean that there might be mental retardation in their children, their offspring. The birth weight could be lower than 1,500 grams, and accordingly health problems in the child might occur after the delivery. These children are prone to more childhood years abuse, and because of epigenetic factors they might develop an inclination towards drug or alcohol abuse, causing certain problems like commitment problems, dyslexia, aggression, depression, and other psychological problems, which further increase their inclination towards drug or substance abuse. We see that these are also transferred across generations because of these mechanisms. Another important factor is institutional care. If you're working with children, or if you work at Symposium in Turkey, you might have come across many cases, particularly for girls. They are under institutional care. These children arrive at institutional care because of trauma reasons. But the institutional care might also cause new problems for these children. They can't quite protect the children. Some run away from their institutional care. They make a living out of prostitution, and alienation by the families for these children are quite often. The boys are more protected by the families. However, the families are more inclined to cut their ties with their daughters, causing these children to be more inclined towards drug or substance abuse. These alienated children are put under institutional care, and unfortunately these children develop these drug addiction, and their families say, oh, the children were broken anyhow, so they're not seen as victims of a problem, they are seen as perpetrators of an addiction. So all of these social problems result in an hostility by the society and also towards the society by those children. This is all I have for my presentation. Thank you very much.